Starting Saturday, Americans with health insurance can be reimbursed for the cost of COVID at-home rapid tests. President Biden is also directing his administration to distribute an additional 500 million tests to people all across this country. It's on top of the 500 million tests already in the works, and the news comes as the Biden administration has come under fire over testing shortages. Vice President Harris defended the White House's COVID response amid the criticism.
So let me start with saying that people are rightly frustrated with where we are. We're frustrated. We're all frustrated. But I think it's a mistake, and it would be a mistake to suggest that we've not seen great progress. Now we have a vaccine, which has proved to be effective, and boosters. Now we have our children back in school. 95% of schools are back open. But we're building back up. We're opening back up. And we are not where we were a year ago.
For more on this, I want to bring in CBS News MoneyWatch reporter Megan Cerullo. Megan, welcome. The White House actually had to walk back comments Vice President Harris made about when those 500 million free at-home tests will ship to Americans. She had said next week. The White House said, actually later this month. Is later this month a little too late for people who are looking for them right now?
It's certainly progress in the right direction. It's a good step forward. But as we all know, Omicron is peaking now, and immediacy is really of the utmost importance. If it takes another couple weeks for people to know if they're infected or not, that's exactly how this virus and these infections spread. So critics of the plan and of the administration's efforts thus far really have highlighted how essential it is that we get these tests right now. They're easier to come by in some European countries, for example. A friend just came back from Germany with a stockpile because they're easier to find now. But it is a step in the right direction.
I'm sure I'm not the only American who hears health insurance and reimbursement and starts breaking out in hives, but I guess that's the way we're going to do it here. What are the rules for people who have outlaid cash for COVID tests and now want that money back from their health insurer?
Well, we're not eligible for reimbursement for tests we've already purchased. So there's no retroactive reimbursement. And according to the rules, private insurers are required to reimburse Americans for the tests they buy beginning this Saturday. They are incentivized. They're encouraged to set up networks of preferred retailers where consumers can get those tests for free at the point of purchase. But because this is so sudden and Saturday's in 2 days, those networks may not be set up by then. So Americans are encouraged to save their receipts. They buy a test, keep that receipt. And like you said, the process for seeking reimbursement could be cumbersome, and it depends on the rules that your insurer sets up. But it'll be much like when you seek care from an out-of-network provider and have to go through that process. There could be delays. And, these tests aren't cheap. So for a family of four, if you're $30 a box, $60 up front, out of pocket. It's going to be tough for some Americans.
It's definitely going to be tough for some Americans. And then you're talking about keeping receipts. And I'm sure there's going to be a form involved. You're going to have to print it somewhere. You're going to put it in an envelope, and then you're going to send it off to your health insurer. How long do we think it will take before Americans can get their money back?
It depends. And the other part of this is this only applies to Americans who are privately insured. So we know a number of Americans are uninsured, and it doesn't apply to Medicare patients either. And this highlights some of the inequities that we've seen throughout the course of the virus. In their case, they're going to have to go to a website that has not yet been set up and order these tests. Of course, some of the folks who need these tests the most don't have internet connections.
Yeah. So people without insurance can get free tests if they find a location by going online, but they may also lack internet. So what do you think needs to be done to address this most in need and at-risk population?
The Biden administration will make 500 million of these tests available through that folks can order through this federal website. The other important initiative that the administration is taking is they will distribute 50 million tests to community health partners that folks can visit and get access to tests. But again, the big criticism of this plan is that it's a little late in the game, and also there remain supply constraints. So it doesn't matter how much they cost if they're not available, and you can't get them, that's not going to help us contain the spread. So experts continue to highlight supply constraints as a concern as we move forward in the fight against COVID.
All right. MoneyWatch reporter Megan Cerullo. Megan, thank you very much.